Hello, my name is Scott Smith, and I'm a technical consultant with the Center for Behavioral Health and Justice at Wayne State University. This training is about serious mental illness and how assisted outpatient treatment can help in your efforts to work with this population. Overview of assisted outpatient treatment. Assisted outpatient treatment was designed to address gaps in the law between where law enforcement could act and where the mental health system could act. And we'll be using some specific terminology today that we all need to have a shared understanding of. The term crisis, in the context of what we're talking about, is a temporary state where an individual has exhausted their ability to cope with the psychological, emotional demands they are facing. This is a short-term situation. Developmental disability, often abbreviated DD. This is a condition, like autism spectrum disorder, that results in impairment in areas of physical bodily control, speech, language, intellectual ability, and/or general behavior. Mental illness refers to a maladaptive pattern, meaning it's causing their life to not work for them. Pattern of psychological, emotional, and/or social behavior that's not related to their culture or developmental stage. It can be short-term or long-term. For example, post-traumatic stress disorder, PTSD, or depression. Serious mental illness, SMI, is a mental illness that is so severe it results in the individual being unable to function without significant support. An individual is considered disabled and therefore eligible for disability benefits. The most common diagnoses we see for individuals who are designated as living with a serious mental illness are schizophrenia, bipolar disorder, schizoaffective disorder, and certain forms of major depressive disorder that don't respond to traditional treatments. The term psychosis refers to an impairment in reality testing. That is, what seems real to the individual is not real to everyone else, such as happens when they're hearing voices. This is common to many mental illnesses, and it's not always a part of a serious mental illness. And it's also important to recognize that psychosis does not automatically mean that somebody has schizophrenia. But psychosis is a serious symptom, and it's one that is the subject of many petitions, including those for assisted outpatient treatment. Individuals who are living with a serious mental illness are more likely than others living with a mental illness to not seek treatment, not adhere to existing treatment. They're less likely to function independently. For example, they may have to live with family well into adulthood. They're less likely to develop and maintain good social supports because they often avoid those who point out that they're ill. And they're also unlikely to recognize that they have an illness at all. That is, their symptoms actually impair their ability to recognize that they're sick. Untreated serious mental illness is a significant contributor to increased rates of suicidal and self-harming behaviors, violent behaviors, homelessness, and housing insecurity in general. It also is associated with high use of emergency rooms and a high rate of inpatient psychiatric hospitalization. And the big one is a significant contributor to increased rates of contact with law enforcement. Now, there are many reasons why individuals living with a serious mental illness don't treat their illness. And assisted outpatient treatment is specifically designed to address some of those reasons, including poor access to mental health treatment, housing instability, and not just people who are homeless, but also those individuals who are bouncing around, doing what we call couch surfing. Those individuals who are using alcohol and other drugs. People who part of their symptom presentation is paranoia related to treatment. For example, individuals who might believe that their medications are poison or that the mental health team wants to hurt them, not help them. And a condition known as anosognosia, which is just a fancy term for the impairment in the ability to understand or recognize that you're sick. And this is really a significant part of what's going on for individuals who are targeted for intervention with assisted outpatient treatment. And the reason is that when individuals living with a serious mental illness experience anosognosia, it directly compromises whatever treatment they're experiencing by interrupting it. It makes it unlikely that they're going to adhere to any of the treatment from day to day. And ultimately, every time they stop their treatment, things get worse. Now, this condition historically was recognized as occurring in stroke patients, individuals with dementia. It's a neurological phenomenon, and we have a better understanding of what actually is happening in the brain among individuals who are experiencing anosognosia. So this is a more common symptom, but in the context of mental illness, it's one of the biggest that AOT can actually help address. Now, this has been considered a part of more serious mental illnesses since the year 2000. And the American Psychiatric Association has described since that time anosognosia or anosognosia-like symptoms as normal occurring during the course of schizophrenia. There's still some debate over whether or not we should call this phenomenon anosognosia in patients with mental illness, but the way it presents, the way it acts is identical to what we see in other patients. Now, how common is it for individuals to experience anosognosia when they're living with serious mental illness? Well, across multiple studies, it turns out that it's very common, with some studies estimating as high as 98% of individuals who are living with schizophrenia experience anosognosia. And for those individuals living with bipolar disorder, especially when they're primarily experiencing the manic phase of bipolar disorder, nearly half, 40%, are estimated to experience this. This is very common when somebody is feeling that grandiose, exuberant feeling associated with mania. They don't want to take their medications because their medications don't let them feel that, don't let them feel as powerful or as capable. And as a result, individuals living with anosognosia are very resistant to treatment. They believe that they're fine, they're not sick, they don't need any help, and they don't adhere to treatment. And there's a growing body of evidence that suggests when individuals with a serious mental illness don't consistently adhere to treatment, that their condition is less likely to respond to those treatments and that they're at risk for other advanced neurological illnesses down the road. To better understand what's going on with somebody who's experiencing this inability to recognize their illness, we need to understand the parts of the brain that are affected. So the first part that's affected is the frontal lobe, which is responsible for helping us to move our body, to the broader process of thinking or evaluating something. It's responsible for our feelings, imagination, decision-making. It's the part of our brain that really is what makes us human. And within that frontal lobe is a little area known as the prefrontal cortex. Now, important to recognize about this part of the brain is it's the last to develop. It doesn't develop until we're in our mid-20s. So when you're thinking about somebody with an impairment from an anosognosia, think about how their brain might function more like a child's than like an adult's. That is, they're going to have difficulties making good judgments, challenges planning, decision-making is going to be compromised. They're going to have a harder time regulating their emotions, and their impulse control is going to be poor very often. Another part of the brain that's affected is the parietal lobe, which is basically where our brain takes in all of the information from our five senses, pulls it together to help us interpret what's going on around us, right? So what's important to remember about this part of our brain relative to your job in law enforcement with somebody who might be experiencing the symptom is that it's this part of the brain that helps us interpret what we're feeling in terms of pressure. How often have you heard somebody say, these cuffs are too tight? And you did the check, you locked them in, you know that they're not too tight. It's easy to assume that they're simply trying to get out of their handcuffs. But for many individuals with a serious mental illness experiencing the symptom of anosognosia, they don't have the ability to properly recognize pressure or pain. They have a hard time rating their actual pain. And it's interesting that this part of the brain has been linked in multiple studies to greater risk for opioid use disorder. And this might be why, that inability to evaluate pain effectively. It's also how you would interpret the sensations of heat and cold, and quite likely explains the decreased sensitivity that we often see among individuals who are living on the streets. Too often they die of exposure, even when there were options for warming centers, for cooling centers. And one possible explanation might be that the part of their brain that's responsible for letting them know that the weather is too severe isn't working quite right. The final area of the brain that we believe is affected by this condition of anosognosia is a very small region of the brain, the insula. And this is a part of the brain that we're learning a lot about still. But what we know is that it's responsible for the highest level functions that we engage in as humans. And it's responsible in a way that has more of an evaluation-oriented / selection-oriented role. So, for example, our emotional reaction, especially the intensity of how we react. Do we react disproportionate to the situation? This part of the brain seems to control that. It works with that other part of our brain, the parietal lobe, to evaluate the intensity of pain. It's also the part of our brain that seems to be activated when we're making decisions when we're emotional. So it plays a role in risky decision making. We know that when we make decisions when we're really angry or when we're really happy or in love, those aren't always the decisions that we would make if we weren't feeling those intense emotions. And this is the part of the brain that seems to be responsible for that. It's also where we form our ability to sympathize and recognize others' emotions. And finally, it plays a role in our awareness of our physical self, that is, the sensation within inside our bodies. It's what you might recognize before a critical incident or in the aftermath, where you're aware of the tightening of your muscles, the increase in your heart rate, the additional sweating that might be occurring. And because these areas of the brain are affected, we need an intervention that assumes that there's a compromise in this type of function. And this is where AOT comes in and can be so helpful. The purpose of AOT orders. The goal of assisted outpatient treatment is to reduce the negative consequences associated with untreated serious mental illness, especially suicidal and self-harming behaviors, violent behaviors, housing instability, alcohol and other drug use, high utilization of emergency rooms and inpatient psychiatric hospitalization, criminal behavior, for example, property destruction, and overall contact with law enforcement. Assisted outpatient treatment accomplishes its goal by addressing treatment non-adherence from two separate directions. First, by targeting the individual, compelling them via a court order to receive appropriate mental health treatment. But it does something else. It also addresses the issues by targeting the mental health system, and that is committing the mental health system to provide treatment and ensure that the treatment is occurring. Sadly, sometimes this is where the system does fail. And as a law enforcement officer, you've probably had experiences where you've attempted to do everything in your power to help somebody, to connect them to services, and those services don't seem to function properly. Assisted outpatient treatment is specifically designed to help ensure that it does function the way it's supposed to. Assisted outpatient treatment is available to adults, and specifically adults who have a serious mental illness or a developmental disability and don't understand that they need treatment due to impaired judgment as a result of their illness. That's the anosognosia we were talking about. are unlikely to voluntarily participate in or adhere to treatment to keep them from harm. Those who have a mental illness, not just a substance use disorder, not a neurological disease like dementia, such as Alzheimer's, and those for whom, without treatment, are likely to deteriorate, resulting in harm to themselves or others. And it's important to focus here on the fact that the harm isn't always immediate and it's not always direct. Sometimes it's unintentional. So an individual might expose themselves to harm because they believe people are out to get them or chasing them. So they take a risk they otherwise wouldn't, like darting into traffic to escape a non-existent pursuer. Or they believe somebody is actively seeking to harm them, and they respond in the way that any of us would, with self-defense, except that their perception wasn't accurate. Nobody was actually trying to hurt them. And one thing that I want to highlight too about assisted outpatient treatment is that it's something we can do in a preventative framework. That is, for individuals who we know their history, something essential to determining whether AOT is appropriate. And we know that when they're not adhering to their treatment, that they often try to hurt themselves, that they often run away from their support systems, that they engage in certain criminal activities. We don't have to wait for them to do those things to take action. Assisted outpatient treatment actually allows us to intervene ahead of time to try to prevent them from experiencing these harms. The judge reviewing a request for assisted outpatient treatment can order a number of services. And it's important to recognize that the mental health professional that evaluates the individual should be recommending to the court what to utilize. In different states, there are different practices, but generally speaking, a judge can select from any of the following interventions. Case management. That is, services that help a person kind of get their affairs in order, that make sure that all their doctor appointments are being scheduled and are happening. It's basically, think of somebody functioning like a coach. They're finding ways to help the person better understand their illness, finding ways for them to live a more full and productive life. The judge can also order that the individual adhere to medication and order specific medications that the treatment team believes will prevent a relapse of their condition. What's really important here is that this can often occur via medications delivered as long-acting injectables. That is, an individual can get an injection once every 3 to 6 weeks, and the medication will work consistently over that time period. This cuts down on the need to take medications daily. It reduces non-adherence to medication because somebody loses their medications, all very common reasons. Many individuals who are placed on long-acting injectables decide that they like the convenience and actually request to stay on long-acting injectables, even when they're no longer under court supervision. The judge can order lab tests to determine if the individual is taking the medication and if it's working. They can order traditional outpatient therapies, including individual group treatment, day hospital, partial day hospital programs. They can order educational, vocational training, supervised living like adult foster care, that is group homes. They can request high-level oversight of an individual, case management that is far more intense than normally offered, something known as assertive community treatment or forensic assertive community treatment for individuals with a history of criminal justice involvement. Think about having a team of individuals available 24/7 who are checking in on you because you too often have, contact with law enforcement. You're going to the emergency room 3-4 times a week. Under an assisted outpatient treatment order, a judge can order alcohol and other drug testing and treatment. This is significant because this is one of the few ways that an individual can be compelled to get treatment for a substance use disorder. It's important to recognize that nearly half of individuals living with a serious mental illness have a co-occurring, that is, a problem occurring at the same time with drugs and/or alcohol. And the court broadly has the discretion to order other services that are believed to be able to prevent relapse or deterioration of their mental health. And what you can see from the services that are available is that it's comprehensive. It's going to address the numerous different types of challenges that somebody living with a serious mental illness experiences. Thank you for your time watching this webinar. This training is presented as a part of the Michigan Assisted Outpatient Treatment Toolkit. And to learn more, please visit behaviorhealthjustice.wayne.edu/AOT.